surely gonna try.
Okay, everyone, it's 11:30 Mountain Time, 1:30 Eastern Time. So we're going to go ahead and get started with our webinar today. Thank you for joining us wherever you are in the world. On behalf of the Shingo Institute, my name is Corey Keat, and we are particularly excited today as this is our first webinar that we are hosting as the Shingo Institute. In case you didn't receive the message from our Executive Director, Robert Miller, this morning, the name, the Shingo Prize, will now refer to the actual prize itself, while the organization that administers it will be the Shingo Institute. As part of the John M. Huntsman School of Business, Utah State University, we feel this change illustrates better who we are as we broaden our focus on educational opportunities like study tours, workshops, conferences, and our executive education program, as well as we begin intensive research initiatives. Just a reminder and an invitation to save the date for our 26th International Conference that will take place in Sandusky, Ohio from May 5th through the 9th, 2014. It is a ways away, but we'll be here before we know it, so make sure to get it on your calendar as it is going to be a phenomenal experience. And now I'd like to introduce you to our presenters today. We're going to switch over to their presentation. Mark Graban is an internationally recognized expert in the field of lean healthcare. As a consultant, author, keynote speaker, and blogger, you can visit his blog at www.leanblog.org. He is also a past Research Award recipient for his book Lean Hospitals that he received in 2009. Mark is also the Chief Improvement Officer of KaiNexus, a software company that offers a cloud-based collaborative platform that allows employees to engage in making company-wide improvements. You can visit kainexus.com for more information there. And Joe Swartz is the Director of Business Transformation for Franciscan St. Francis Health of Indianapolis, Indiana. He has been leading continuous improvement efforts for over 18 years, including 7 years in healthcare, and has led more than 200 Lean and Six Sigma improvement projects. Together, Mark and Joe are recent recipients of the Shingo Research and Professional Publication Award for their book, Healthcare Kaizen, and we are very pleased to have them with us today, and we'll go ahead and turn the time over to them for their presentation. Mark and Joe.
Joe and I are going to be talking about some of our experiences and lessons learned and things that are important in creating a culture of continuous improvement. And Joe and I have backgrounds in manufacturing before we got into healthcare, each of us about 8 years ago. And I think these are fairly universal lessons, but we're going to illustrate what we're talking about today with examples from healthcare. But stepping back and looking first at Toyota as a model of an organization that really embraces continuous improvement. We have a Toyota plant here in San Antonio where I am. They've been gracious to host people from healthcare, and I've gone on part of those tours to help people understand how lean is a culture and a management system. And Toyota describes their Toyota Way management system what they call equally important pillars of both continuous improvement and respect for people. And these really very much go hand in hand. And when you visit Toyota, and the healthcare people who went there saw in the visitor center, the first words and concepts you see are Kaizen and Toyota describing what they mean by respect for people, engaging everybody in improvement being a big part of that respect for people notion. And Kaizen, I think, is an extremely respectful way of getting people involved in improvements that matter to them. The word Kaizen itself, the Japanese word, can be translated directly to mean good change from the two characters. The context usually is used in the terms of continuous improvement. And we have a growing number of organizations in healthcare today, thankfully, embracing this style of improvement. And you could say a rose or a Kaizen by any name would be as sweet. Theta Care in Wisconsin calls this daily continuous improvement. Virginia Mason Medical Center, University of Michigan, health system and others have a program and an approach called ELI, or Everyday Lean Ideas. They use the term quick and easy Kaizen at Joe's organization. Another health system in Indiana that we featured in our book for having a great continuous improvement culture has a broader program. I think it's an interesting name, called the Uncommon Leader, because I think they're focusing on leadership behaviors and changing the way we participate in improvement and the role of leaders in that. We've learned a lot from Misaki Imai, who wrote, I think, a seminal book, or at least introductory book in 1986 that introduced Kaizen to America, the Western world. And Mr. Imai's still active today and has so much wisdom to share. But talking about this philosophy, I think Kaizen is a very upbeat, optimistic, cheerful philosophy. It's just assuming that everything about our way of life can be better, and that it deserves to be constantly improved, that people deserve to have a workplace that's less frustrating, that patients deserve to have care that's provided in a more timely way and without harm and without defects. That's what we're trying to improve with Kaizen in healthcare. So the word Kaizen has also gotten to be really associated with a formal project called sometimes a Kaizen event, of having a team of people for 2 to 5 days. ThedaCare calls these rapid improvement events. Virginia Mason Medical Center calls these rapid process improvement workshops. And Kaizen events are great for problems of a certain scope and size. There is a time and a place and a real benefit that comes from pulling people out of their work and really let them focus deeply on understanding a problem and fixing at least initial countermeasures, initial tests of those changes in an event. So Kaizen events are great, but to use the breakfast commercial, the cereal line, that Kaizen events are just a part of this complete nutritious Kaizen breakfast. I think leading organizations are not just doing events, and they're not just doing daily continuous improvement, that they're doing both. We see organizations that started with rapid improvement events and then realized that, well, gosh, not everything needs to be a formal week-long project. Some problems are small enough and simple enough, and they're in the range of a just do it or a small PDSA improvement, that we can do things on a more continuous basis throughout the day or throughout the week. So we have the small daily Kaizen, we have a middle range that could be Six Sigma projects or Kaizen events, and then the top range of this scale, and this is a diagram from Joe's organization, looking at big strategic improvements like a new tower or a new EMR system. We really need to do all of these types of improvement, and the thing that ties it together is PDSA, plan, do, study, adjust, whether it's a small problem, a medium-sized problem, or a huge problem. I think one other thing we've learned, and this is not necessarily a new learning, but I've seen it reinforced in my own work in manufacturing and healthcare, is that suggestion boxes are a very poor way of facilitating Kaizen. It's really hard to find anyone to come to the defense of their suggestion box. It's people will make comments like, yeah, that box is where we throw our empty gum wrappers. If you open up the box, you might find something. You might find pieces of paper that have been sitting in there for weeks or months. Part of the problem is the box, in that it's literally locked and opaque, and it's a batch process. And it's also in the way the suggestion boxes are managed and where Kaizen presents alternatives. With Kaizen, it can be more of an ongoing, transparent, collaborative process where managers don't just say yes or no to ideas, but managers work together with employees in a collaborative way to find ideas and countermeasures and solutions that solve problems that people have been identifying. And so we see more healthcare organizations aspiring to an ideal that I think originally comes from Toyota, the idea that everyone has two jobs in the workplace: to do your work and improve your work. 100 years ago, industrial engineering separated improvement from the doing of work. And one thing that Toyota and other organizations have done is bring improvement back into the realm of being everybody's job, that the people who do the work are the experts. You still may have coaches and facilitators and people helping you out, but we certainly want and need to have frontline staff involved in the improvement process. They deserve to be involved in that improvement process. I think Toyota, makes a very bold statement. This was on their website a few years ago. On their corporate website, under the banner and the question of what sets us apart. And they talk about every team member being empowered with the ability to improve their work environment. I think this is a key. Kaizen in healthcare is not about dumping the world's problems on frontline staff. It's about engaging everybody in things related to their work, things they run across on a daily basis, things that adjacent departments in a process are involved in. We're not expecting them to solve world hunger, as people like to say, but improving things in their work environment, quality, safety, the environment. We see a lot of people bringing ideas forward around, quote unquote, green ideas and environmental stewardship in hospitals, and productivity. And I think it's interesting that Toyota says that these improvements are the cornerstone of Toyota's success. And having had a chance to visit Toyota visitor centers in Japan, they really do go out of their way to highlight and show off improvements made by frontline employees. I think that's a very striking part of that culture. And so, yeah, Mr. Amai, who's brought ideas forward saying, Kaizen is for everyone. And Joe and I have both learned a lot from Mr. Amai and his work. You have our good friend and our mentor, Norman Bodak, who talks about why Kaizen is important. And this is different than, I think, a traditional process improvement approach that might only be focused on, let's say, cost reduction or financial benefit. Norm promotes a broader view that we want people to be engaged, making your work easier. That's not selfish. That's good for the organization. That's good for the patients when we can make work less frustrating, make it more interesting. And that Kaizen is also a way of developing people's skills and capabilities, not just driving results for the organization, but developing people, which is also a core theme for Toyota. But then in 1989, Dr. Don Berwick, who some of you may know as the founder of the Institute for Healthcare Improvement, he published an article in the New England Journal of Medicine, of all places, really wide, broad exposure, talking about the need for Kaizen in healthcare, how we need to continuously search for the opportunity to make processes better. And Don Berwick's article cites Dr. Deming, who was still alive at the time in 1989, and comparing a good culture that helps continuous improvement happen versus a bad culture that stifles people and kills or squashes improvement. So I think it's fascinating. Almost 25 years ago now, Dr. Berwick, a very high-profile person in healthcare quality, was saying, hey, Kaizen is good. We need this. But even today, in 2013, there are many, many barriers to Kaizen. List of reasons, if we ask, well, why do we not have a culture of continuous improvement? People brainstorm a long list of things. But rather than letting those barriers be an excuse, I think we need to turn those into problems to solve in a couple of different ways. How do we address these barriers to get them out of the way, rather than to say, well, oh gosh, we have these barriers, so let's not even try. One of those barriers, and it's completely understandable, is the fear of layoffs. This is a cartoon I found in a hospital years ago, before they were doing anything with lean. If people have this fear, or if it's been demonstrated in the past that process improvement leads to layoffs, people will not participate. I think that's very easy to understand why. So leaders in, I think, a culture of continuous improvement are very publicly and specifically making a pledge to say there will be no layoffs due to lean, due to Kaizen, due to continuous improvement, that people's jobs might change, but they won't be laid off. We need to eliminate that fear and that barrier. Another barrier is, we don't have time. And so I always like to challenge and say, well, we need to make time. How do we make time? Hospitals, and I think in the last 10 years, have taken it for granted that when patient census drops, that we, quote unquote, have to send people home early. And well, that's a choice. This idea of flexing, sending people home early because they don't have direct work to do, I think is very short-sighted. So it's, I think, a lean philosophy to look at the long term. When we went and visited the Toyota plant here, and a nurse asked, well, how do you make time for Kaizen? People are busy building trucks all day. And so, well, when we have downtime, we work on Kaizen. Or if people have ideas that are worth working on, we pay them overtime to make that improvement, not because it's nice, but because it's good for the organization. I think it's also good to challenge the idea of, do people really hate change? I think this gets thrown around a lot without being really thought about. Peter Schultes, the great professor and author who passed away a few years ago, I think summarized it really well when he said, people don't resist change, they resist being changed. And so I think a lot of time when leaders are saying, my people are resistant to change, what they're really saying, and it may be a polite way, is, my employees won't do what I'm telling them to do. Like, well, we're human beings, we're adults, we have, we have the ability to make choices and to think, and we have to involve people in changes. That gets rid of a lot of that resistance. Margaret Wheatley, and you can find a great video with her on YouTube, talks about the idea of people support what they create. So it's really tempting in healthcare to say, well, we're just going to take these evidence-based best practices and we'll force them on people. And I think we can find a balance. We can look at evidence, we can look at best practices, but then help people create the version of that that makes sense. We have that sense of ownership, that sense of engagement. And then a couple thoughts before handing it over to Joe. As we go through this process, one of the barriers is that sometimes organizations are stubborn about honestly evaluating a test of change. If we look at the plan, do, study, adjust cycle, I've almost come to think it should be plan, test, study, adjust cycle. That if we aren't willing to be open to the idea that some changes just don't work out the way we expected, that causes people to cover up problems and not really fully go through iterative PDSA cycles. I love the example that Joe's organization is humble enough to share of a Kaizen that on one level was an improvement for the maintenance department coming in and putting in automatic paper towel dispensers. Could have been counted as a Kaizen improvement. But what they learned in the neonatal ICU is that the paper towel dispenser was too loud. It was waking up the babies. It was causing a problem. And a lot of organizations in a top-down improvement environment would be really stubborn about this and say, well, we know those automatic dispensers are better. But they honestly evaluated in the study phase that, gosh, these paper towel dispensers don't work well in this environment. It's causing a problem. We need to go back. We need to click undo and go back to the old way of doing things. We need to be open to that possibility. And then looking at iterative PDSA cycles, whether something didn't work as expected or sometimes a Kaizen improvement doesn't completely eliminate a problem, that's okay. People in healthcare sometimes get very cautious or they want to have a perfect solution. And I think in the Kaizen mindset, we want to close the gap in performance. We want to alleviate the problem a little bit and then keep improving and keep improving. And there's great examples in the book from Joe's organization about how they've done that. Iterative improvements, building upon each other, getting closer to an ideal state than trying to have one big, huge swing for a home run improvement. We find also with Kaizen that there's a time and a place for root cause problem solving. It might be a controversial statement to say, well, you don't always need to look for a root cause. Like sometimes you just need to fix something. And it could be that, hey, we've got a broken chair, and through the Kaizen process, somebody says, let's get that chair fixed. That's not necessarily the deepest, most meaningful process improvement, but it's made things better. But let's say we have lots of broken chairs over time. Now we might start looking for a root cause. Are we buying the cheapest chair possible, or the chair is not appropriate somehow for the way they're being used? Then we might do more rigorous problem solving, but still try to keep an experimental mindset in place. If we're going to try a new style of chair, don't buy 1,000 of them, buy 1 or 2 and try them out and test the change and see if things are improved. So a final thought before handing it over to Joe is that I think I would propose there's this formula that helps make Kaizen happen. In any industry or any organization, you need a very strong mission, a sense of purpose that you're connecting people's work and improvement work to. It requires respect in all directions within the organization. It requires time. We need to not just collect ideas, but also make time available. Provide a little bit of training about Kaizen concepts and lean principles, that all together leads to Kaizen, that leaders create that environment where people can really thrive and shine and make Kaizen happen. So with that, I'm going to hand things over to Joe Swartz, who's going to talk more about some of the concepts from the book and from his organization in terms of creating a Kaizen culture.
Good afternoon. This is Joe. Everybody hear me? So in the next slide, Mark and I have a list of attributes of a Kaizen culture. And these are attributes we've experienced when we've gone into cultures that are really innovative. You know, everyone's engaged from the top to the front line, and they're relentlessly searching for opportunities to improve. They have a sense of control over their workplace and over their destiny and their lives. Patients and customers are happy. The employees are happy. There's a sense of joy at work on a daily basis. Things flow. Everything just works. Things are clean and orderly. Everyone works together. Everything gets questioned. And the small successes are celebrated along with the bigger successes. There's a concerted effort to really recognize all successes, no matter how small, because they know that leads to greater successes. And on the next slide, we kind of, how do you create this culture of continuous improvement and innovation? On the next slide, we kind of, Mark and I propose that you really have to put most of your efforts towards the frontline staff. It's really, if you want to change the behaviors in your organization, it is led by the top people, but it's really realized at the front line. So if you can do something that influences how frontline people think and behave, you will have changed the culture. And we believe Kaizen is one piece of that. Another instrumental piece is the next one down, the supervisor, and that interface between the supervisors and the frontline staff through coaching. If you have a good interface and the supervisors are coaching frontline staff, then the rest of the organization just supports. The managers, directors, VP, CEO, they support the effort, but it's mostly in an inverted approach. On the next slide, it's just pointing out that when you first implement Kaizen, it should be really quick and easy. If you're going to address all staff, no matter where they are in their lives and in their workplace, you really need to make it quick and easy for them to do if you're going to capture some time from them every day to do this. There's 5 steps on the next slide, 5 simple steps. We really boil it down to try to keep it as simple as we can. The first step is see opportunities, see problems, and find improvements that'll improve those. Discuss, implement, document, and share. And we'll go through each one of these. On the next slide, the first step is see and find. And you're looking for problems or deviations from the ideal state, or things like interruptions, errors, things that just don't work quite the way you want to, or opportunities to make a better service experience for our customers. And then go find an idea that'll produce a solution for those problems or opportunities. The next slide is an example, a real simple example. It was an outpatient behavioral health office where they were experiencing a squeaky drawer on a file cabinet, and the manager pointed it out to them and asked, what could we do about it? And they let these gals figure out how to solve the problem. And he helped coach them through this, and they figured out what it would take to oil the drawers. They went out and got the oil and did it all themselves and turned this into a Kaizen. And this was their first Kaizen. It seemed like a trivial Kaizen, but it got them started. And they started turning in Kaizen after Kaizen after Kaizen because they started seeing the benefits to them and to the patients. In the next room over from this was a patient waiting room. So patients were actually hearing the drawers squeak, and now they resolved that problem. And so they saw the benefit to them and their customers. Next slide is step 2. We ask each Kaizener to discuss with 2 people. One is anybody that's going to be impacted by this change. It's important to engage people. Rather than push change on people, get them engaged in the discovery and in the dialogue about, what could we do here? If they're engaged in the questions, they're more likely to be okay with the solutions. And then seek coaching from the supervisor. The supervisors are taught and trained to coach each Kaizener in implementing their idea. On the next slide is an example of where Nancy Thompson's one of our educators in our pediatrics unit. She had an idea for a number of years of putting a thermometer in every room, because at that time nurses would have to go to a central supply room to get thermometers, and it would take them extra time. And for years she had gotten turned down. In 2008, she went to her boss, Nancy Moser, and said, I need to make this happen. How do we do it? Nancy taught her how to go through the cost justification process, how to document the time that was spent by nurses going to the supply room and the time that would be saved by having one in each room. And together they worked through that and were able to cost justify thermometers in every room. Nancy Thompson became a hero for all the nurses in the unit. But here's what's really important. Nancy Thompson now, after that, knows how to do return on investment type things. And she went on and did numerous other projects like that, where she cost justified things for the nurses to make things like that happen. So it's part of the Kaizen is really developing people. On the next slide is just to point out that when we ask these employees to go implement things, it doesn't have to be just them. They can engage other people. And the example on the next slide is just a real simple example. It's two pharmacists, Therese and Rex. Therese had this idea for putting this little plastic cover on top of a trash can, or recycling can, to just make sure only cans got into there. But she didn't know how to do it. But she found out Rex had a job shop in his garage at home, and so she asked Rex, can you help me do this? And together they did it and turned it in, and voila, a Kaizen. So on the next slide is just about step number 4, documenting. We want them to document very simply. This one's a nice example. Pill cutters and pill crushers, before they were in the compounding area, after they were moved to a shelf opposite the tube station, it saved time and steps. It made it easier to reach for to put in the tube. So you can see, very simply recorded. It recognizes the Kaizeneer and their supervisor that coached the Kaizeneer on this. So very simply. Next slide is a bulletin board in a unit that won an award at our facility. I think it nicely demonstrates Kaizen. The water picture represents ideas and problems that are raining down on the unit. And if you'll notice, the petals that grow up around the flowers are the Kaizens, but in the center of the flowers, you'll see pictures of staff, of employees. That recognizes that the fruit of the flower is the people, and Kaizen's really about developing people through them implementing Kaizens and getting experience making small changes in organizations, so they learn how to make organizational change and they become more accepting of organizational change in general. The next slide is just a real simple example of cost savings. And what we did is, a few months before this, we sent an example of savings of about a few $1,000s about items that weren't placed in the sterile field in surgery yet. Because once we place supplies in a sterile field, they have to be thrown away or used. So if we hold some back, we can save them for another time. And so they saved a few $1,000s. Then we took that Kaizen and sent it to all 4,000 employees. And then over the next numbers of months, we got much more Kaizens along that same idea, that same vein, including this one for $57,000 a year in savings. So a nice example. The next slide is, we want Kaizeneers to start small, because we want them to learn this process, this change process, very simply and easily, so they'll gain experience and knowledge and they won't be shut down initially. And like Mark said earlier, we want to start by having them focus on what they know. They know their job. So how can they make their own job easier, safer, more enjoyable? Then after they've done that a while, then start thinking outside of themselves and thinking about the patient, the customer type thing. It's really, Kaizen is really all about developing the right attitude in staff, that they can make change and they can be involved and they can contribute and they can make a difference. It's really a morale booster. On the next slide is one of our first Kaizen that got turned in, and my point here is it can be handwritten, and we still accept Kaizens that are handwritten. It's really important to make it just really quick and easy so they can implement these small changes without documenting something for 20 minutes. It can be done in a really short period of time. The next slide is Peter's first Kaizen, and At one point, Peter's our educator in respiratory, and at one point I asked Peter, how you doing on Kaizen? He said, well, I haven't really had time to do any Kaizen. And one thing I knew about Peter is I knew he had plenty of time to joke and kid around because I'd always run into him in the hallway and he'd tell stories and jokes. So I said, I got an idea for you. Your first Kaizen, can you just turn it in as a joke? Do something really silly and turn it as a joke, and I'll work with your supervisor to get it approved. He said, okay, I can do that. So he turned this one in. And then he turned in a few others that were kind of along the lines of a joke, and then he started turning in real Kaizens. He got engaged. So the key point here is to start where your employees are. Figure out what's important to them, what gets them fired up, what gets them charged, and help coach them to a Kaizen that they can get excited about. And that'll engage them in the process, and then you can get them hooked. On the next slide is just, we're pointing out that Kaizens are instrumental in innovation. Innovation is about trying new things, and the more staff gets engaged in trying new things, the more they're going to be searching for innovative stuff and adopting innovative stuff from other organizations. This is a door-to-balloon process for our heart attack patients. We started it back in 2005. By 2006, we had reduced the door-to-balloon time from 113 minutes down to 75 minutes, made a dramatic improvement. But since that time, we've been using Kaizen to make incremental improvements, and the door-to-balloon time has been coming down ever since, incrementally. So Kaizen really does help you create a more innovative culture. Next, we're going to talk about leading Kaizen. And the next slide, we have a few items that Mark and I believe every leader should do. First step is they have to believe in the power of Kaizen. They have to believe that if they practice Kaizen, they'll see huge benefits if they just stick with it. And they got to carry that belief into every meeting they go into. And then second, they have to participate. You can't lead people in Kaizen unless you understand it yourself and are able to do it yourself. Then you know how to coach people. And then just ask people. And remember, this is not just about improving things for organization. This is about developing people. So you want to create a safe environment, a safe place to try and experiment something, and then let them go experiment and report back to you as the coach, and then help them understand what they learned each time they do this. And then reward, recognize, share, and sell. On the next slide, coaching we feel is really important. And in this particular Kaizen, you can see the Kaizeneer said we should just have people be more careful. And it's the job of the coach to help get down into more of the root cause of the problem, to dive a little deeper, help that Kaizeneer surface what really could be going on here and come up with a solution that would be, awareness fades off over time. So you need a more permanent solution. I had a new manager come to me a few months back and say, Joe, this Kaizen thing's taken me hours and hours every day. I asked her how much. She said it's about 4 to 8 hours a week. And I asked her to describe how she does this. And she said, well, the Kaizeneer comes to me with this idea. I add it to my to-do list. And I said, whoa, let's rethink that. Really, what I asked her to do is spin that back around. Spin that back around on the Kaizeneer and get the Kaizeneer to keep their idea because they have the most passion for that idea. And then you coach them on how they can implement that idea themselves. And I revisited her a few months after that, and she said it's only taken her an hour or 2 a week now because she's having staff do it. And staff is being developed. They're learning how to do this very well. The next slide. Kaizeneers come to coaches with crazy ideas sometimes, but every idea is a gift, and everything should be implemented if possible. So we have a benchmark. We'd like to see 90+% of the Kaizens implemented, even these crazy ideas, because they have a kernel of a good idea in it. So it's the coach's job to figure out what that kernel is and make it into something that's practical, that can be implemented by that Kaizeneer, so that Kaizeneer experiences success. I had a Kaizeneer back in our most prolific Kaizeneer in 2007. In 2009, she hadn't implemented anything. So I went to her and asked her, you were our best in 2007, why are you not doing it in 2009? She said, well, I've got a new manager, and my new manager doesn't believe in Kaizen, and she's told me no again and again and again. So she just got shut down. And I think we're all capable of being shut down, I think, no matter where we are in the organization. So it's really important to work with them to make sure you don't shut them down, that you take something and make it implementable about that, and create a safe environment to test it. One thing we do at St. Francis, we have 7 days grace. That means you can try an idea for 7 days. If it's not working after 7 days, the manager can go in and pull the plug. So people are more willing to try stuff, and most of the time it works. On the next slide, we have Masaki Amai's 3 stages. And just want to point out, in the first few years when you start Kaizen, you want to make a concerted effort to adopt any idea, no matter how small, and say yes to it, and figure out how to make that implementable Kaizen, to build enthusiasm and interest. And then in the next stage, the next few years, you want to dig into more of the problem-solving skills, more of the more technical stuff. Make it quick and easy to begin with, and then start training a little deeper. And then later on, years 5 to 10, then think about financial payback, ROI. Only 6% of the Kaizens that get turned in at St. Francis have ROI associated with them. The vast majority don't, because we want to get them, the staff, interested and engaged. On the next slide is just an example pointing out that it should be for everybody. This is my boss, our COO, his first Kaizen. He had organized his drawers because he didn't like anybody messing with his drawers, so he organized them and color-coded them, and now he can find anything very quickly. And then we sent this out to all the staff to let them know that if our COO can do it, then anybody can do it. And then next, I want to turn it back over to Mark.
Thanks, Joe. And we're going to talk a little bit here about some ideas of measuring Kaizen, and then Joe will share some other examples, and then I think we're going to have a good long question and answer period. So hopefully people will have questions for us. Like Joe said, I think it's a very important principle that we don't insist on a certain ROI threshold for Kaizen improvements. And in fact, I found in healthcare that it can actually be quite disengaging from the perspective of the frontline staff to be talking too much about cost, because they're concerned about improving patient care. They want to improve their work environment so it's not as stressful, so they're not so exhausted at the end of the day, so they're not working overtime. And that's not selfish. That does lead to benefits and improvement. And I think it can be tied together using this diagram here. That the reason that we do, or that I think any organization focuses on employee engagement, on one level, I think it comes back to treating people respectfully. But there's also, I think, the sense that employee engagement isn't just nice, it's smart for the long term of the organization. Dr. Deming and Toyota talk about making decisions based on the long term. So when we have a choice around, do we send people home 3 hours early, or do we let them work on continuous improvement, we want to make the long term decision. But in a Kaizen process, we can have enough structure that allows people to know what they can or should work on. So we clearly don't want to pay people, to stand around and waste 3 hours doing nothing. But we want to have a system that allows them to choose the next idea to work on based on, a visible, transparent process of the things that we want to implement when time becomes available. We engage people in improvement. In healthcare, there's at least correlation. I would argue there's, I think, pretty clear and reasonable, not just correlation, but causation to things like patient satisfaction. Happier employees, better environment, patients are happier, nurses aren't as grumbly, staff aren't so rushed and frantic. They can do a better job with the service aspect of a patient's hospital stay, for example. But I think there's also a lot of studies that show a clear connection between employee engagement and improved quality and clinical outcomes. Fewer errors being made because there's better communication when people are better engaged. People not running around as frantic because they're eliminating waste through the Kaizen process. And that leads to fewer patient falls, fewer pressure ulcers, fewer infections. This can all, in direct or indirect ways, lead to higher patient volume if we've freed up capacity to do more surgical procedures in a day using the same space and staff, or having a better hospital or healthcare environment that makes patients want to choose coming to your environment. And all of this in different ways leads to financial results, not as a primary goal, but again, as the end result of doing all of these other things well. Engaging employees will reduce voluntary turnover of staff. There's a huge financial benefit to doing that. It can cost $75,000 to $100,000 to replace a nurse who quits voluntarily. Patient satisfaction, quality, as payment reform and healthcare reform is kicking in, those have even more clear direct ties to the financial bottom line of the organization. So I think it's an indirect approach. We certainly care about the financial results, but we don't have to talk about cost and financial benefit as much. People will do things that matter to them, and we will get the additional benefit of that financial result. And sometimes you're surprised of what the impact can be. Even if you're not looking for a large $1 million idea, sometimes a small improvement has a surprisingly big impact. And this is an example from one of our KaiNexus customers. And we see in general about 1 out of every 200 Kaizen improvements leads to something with a fairly eye-popping ROI number. And this is the case from a hospital where a staff member identified a problem that patients are going and getting their prescriptions filled at outside specialty pharmacies. And so the improvement was to basically do just a little bit of education, not to be pushy, but just to let patients know, hey, did you know we have a specialty pharmacy in-house? It would probably be more convenient. There would be better clinical connections. This is an option if you would like to do it. Well, then what they found was that in the first 3 months, you can see as it shows here, they switched 167, about 1/3 of their patients, to using the internal pharmacy, which led to $638,000 of revenue that had been previously just walking out the door. And so that's well over, it's about $2.5 million a year of additional revenue that came from a very small change that really cost them essentially nothing to put in place. And so then through this Kaizen process, as Joe talked about, the importance of documenting and sharing this improvement is that within this health system, they can share this idea with other clinics that might have other patients who have been taking their pharmacy work outside of the health system. So final thought on this, when I had a chance to visit Japan for the first time last year, one hospital CEO there said, large improvements can't be planned. That large improvements only happen because you stumble across them when you're doing lots and lots of little small improvements. And I think this is a perfect illustration of that sometimes you'll just stumble into something that has huge benefit and it's good for the patient on a number of levels. So, I think we can argue that Lean and Kaizen are good for all of the stakeholders, for the patients and their families, for doctors, nurses, and other staff, for the hospital and the healthcare organization itself, and it's good for society. That in the Western world and countries that are widely adopting Lean, nobody spends as much on healthcare as the United States, but nobody's happy with the level of spending and the pressures that that's putting on their budgets. Nobody's happy with the rate of increase in healthcare costs. So we've got a really big problem in lots of different countries. Arguably, the best way or the only way to help really make a dent in that problem is to engage everybody in improvement in a very distributed way. And that's why I'm so impressed with what Joe's organization and a lot of other leading organizations have done. So I'm going to turn it back to Joe to present and talk about some of their data from Franciscan St. Francis.
So
Joe?
Here's performance over the last number of years. You can see it started slowly, but built. It took a lot of effort up front to get it rolling, but once it started rolling, it kind of developed a sense of momentum. We've kind of tapered off the last few years. We've been distracted a little bit, but we had more than one Kaizen per employee turned in. So on the next slide, we get a sense of the financial performance. So you can see in 2010, we had $1.7 million in bottom line savings. There was an additional 1.4 million, I think. A total over 3 million in total savings when you include the soft savings. The soft savings was a lot of time saved, things like that. which we categorize and report on to our leadership, you know, time saved, quality improved, things like that. But they want to know, is this making a difference in it? And it is. The last few years we've kind of got distracted, but already in 2013 we're well over $1 million in savings. So we're back on track in spite of all the pressures on us lately to make dramatic cost savings. Next slide. And I think we want to end on this. If you really want real culture change, you have to figure out how to get Kaizen practiced by everybody in an organization. Mr. Amai wrote his book Kaizen in 1986, and first few pages in the book, he makes the claim that Kaizen is the key to Japan's success. So that's quite a bold statement. And I think what he's saying here is the way certain organizations in Japan, particularly Toyota, he spent some time working with Toyota, practice Kaizen by engaging everybody every single day. That does make a huge difference, and that is probably what he's talking about, the key to Japan's success. So on the next slide, we have some contact information in case you want to get a hold of me or Mark. Mark has a great blog out there, has a lot of information, and we have a website there listed. So I think now we're ready for questions, right, Corey?
Okay, great. Yep, we'll go ahead and start with, we had a few questions come in. First of all, this one's for you, Joe. Would you find it more effective if you quantified the benefits, such as estimated time savings per year?
Oh, sure. You mean more beneficial than money, or?
I guess then with money is what that sounds like to me.
Yeah, I think for the
Correct
soft savings, that would be good for soft savings. You know, time savings is kind of sensitive because does that mean FTEs, and do people lose their job? And we want to avoid that kind of thing, or that kind of discussion, or that kind of thinking. So I think it's okay to report that, and we do report that to our top leaders, but they've got to understand that only a portion of that will ever be realized, because there's always other things that people can do. You know, staff, they can spend more time with patients to up patient safety and patient satisfaction. There's always new things coming at us with these Obama regulations. We've got all kinds of new things we have to do. So there's always time consumers. We just got to figure out, do we continue to spend our time on those things, or can we make them simpler? So yeah, I think the answer is yes. Mark, do you have any comments?
Well, I mean, I think it's all about, you know, trying to find a balance. That if you talk about cost savings, sometimes there's a clear, unambiguous, easily measurable benefit. You should go ahead and do that. But sometimes there's a balance between, you know, do you really want to spend a ton of time on trying to measure the precise impact of a particular improvement, or do you want to use that time to go make more improvement happen? I think there's some judgment involved in situations like that.
Sure. Okay, what are the unique challenges in healthcare to executing Kaizen successfully?
Well, let me address that a little bit. I mean, I think the one challenge is that healthcare has been so focused on just doing the work, the doing the work side of that balance. You know, when I worked in manufacturing, even if we had a very, you know, at first unlean organization, you still had engineers and specialists and people whose job it was to focus on process and you know, they might have been trying to improve processes using non-lean principles, but at least you had people and resources, and you could teach them lean principles, and they could start, you know, improving in a different way. You know, in healthcare, I think the biggest advantages are the strong sense of purpose and mission in healthcare, and the passion that people bring to their work. They want to make things better. Just that, and you know, I think the biggest challenge is that there's just been very little focus and time spent on improvement. So there's lots of things to improve. Some organizations that I've coached recently have been very intentionally scheduling time for people to work on Kaizen. They have been coming off of a magnet certification process, and they'd had a bit of a kind of time that had been scheduled for that type of work. And they said, well, we're going to, at least for a couple of months, experiment with scheduling 2 4-hour blocks of time every month for a couple of people, just to give them some bandwidth to work on improvement and get the process going for those bigger, especially for those bigger things that couldn't be done just in a few minutes here and there. Like, one Kaizen improvement that would come up would be about, trying to make sure we have ginger ale available in our refrigerator for patients who request it when they're nauseous. That's a very easy thing to implement. It took a manager sending an email to materials management, and the next day they started getting ginger ale stocked. And then there's going to be bigger things, like say somebody says, we want to rearrange the utility room to make sure we have good parking places for all of our different carts. Now, that might be a little small mini project that you devote a couple of hours to. So just kind of building that as a new habit. And I'm thinking of Chuckle at Joe's story earlier about it being so time consuming for the manager because the manager was trying to do all the improvement themselves. That's, I think, a very widespread kind of habit or pattern in healthcare. And so part of early Kaizen education is helping managers know what they should delegate and what they should help out with, and trying to delegate and distribute the improvement work as much as possible, and then help people have time to do that. I think that's really key.
Great. So there was some discussion in the chat box. One participant asked, staff rewarded with money, and 3 question marks, I think, to demonstrate some kind of strong emotion there. Can you comment on that?
Well, one of the downfalls of traditional suggestion boxes is that it was predicated upon, we're going to give people a big or a percentage bonus of the big, huge improvement ideas that they come up with. And that sounds good in principle, or like, well, if we want more improvement, we should pay people large sums of money and that'll give us more and better improvement. But that breaks down very quickly into 10 different kinds of dysfunction. People argue with each other about, well, you stole my idea and now you submitted it and you're getting paid and I'm getting shafted. People argue with management about how much that idea was worth because of the finances involved. So I've seen either, and Joe share some of what they're doing, because I think they do some very creative, inexpensive things, is that either like small token rewards will people will smile and appreciate that, and they're not necessarily looking for a percentage of that big, huge savings. Or I've seen a lot of environments where there's no rewards at all, and people will participate in Kaizen because they want to. And you're allowing them, and you're giving them time. And I think in healthcare, there's so much of that intrinsic motivation that we don't have to spend too much time on, or we don't have to spend too much money. I think the recognition side of rewards and recognition is really powerful. So I mean, Joe, you have a lot to say about this too.
Yeah, we give them some VIP points for doing the documentation. We give them 200 VIP points, which is worth about $1 in merchandise. They can go to a website and trade that in for shirts and gift certificates and merchandise. But we're just rewarding them for documenting, going through the process. We're not rewarding them based on the merit of what they do. We just want them to practice Kaizen, and so we reward them for that. But we do recognize people by posting their Kaizens on bulletin boards. Every few weeks I send a notable Kaizen to my boss, who sends it to all 4,000 employees, so they constantly are seeing what other people are doing. We have things that hold our badges that say Kaizen Star. We have a whole number of things to just recognize people. It's more about we're searching for intrinsic motivators instead of extrinsic motivators like cash. We want them to just be recognized in small little token things that really charge them up. I think Napoleon once said, it's amazing what someone will do for a ribbon. So it doesn't have to be a lot of money. It's the thought that counts, I think.
Great. So what works best in your experience, to fit Kaizen work into frontline staff daily work or dedicated time? And if dedicated time, what solutions would you recommend for enabling daily Kaizen practice?
Well, I mean, I think it's got to be a little bit of both, because if you're scheduling Kaizen time, and that tends to be maybe a couple of key people, you don't want Kaizen to become something just for specialists, that, well, it's only those people who have the time scheduled. I think, working with people, being in the Gemba, identifying and helping people, without fear, stepping up and saying, I've got some time right now. What can I be working on? Like in a lot of organizations, people are just deathly afraid of admitting they're not busy because they're afraid that's going to lead to layoffs or being sent home early. So, you, as a manager, you have to be out there working with people, finding those opportunities to do little small improvements, and then use that scheduled time for the things that are a little bit bigger and more complex, but don't merit, let's say, a big formal week-long Kaizen event.
Great. So what do you recommend to get frontline staff to ask more questions about roadblocks in their daily work to identify improvement opportunities?
I think leaders need to be out there observing as people run into barriers, talking about it, asking people to speak up. I mean, I found that people's willingness to speak up is hardly ever the bottleneck in the process. It's a question about, is anybody listening to them and is anybody helping? So it does take 30 minutes a day, or even an hour a day. I don't think is outrageous amount of time in terms of a frontline supervisor's or manager's day to be focused on improvement activity. Managers waste lots of time and unnecessary meetings and all sorts of other things that really aren't helping much of anything. I think managers need to be out there. They need to be visible. They need to be building trust with people. They need to be collaborating. That takes effort. Joe?
Yeah, I agree. There are things you can concertedly do, like Theta Care has their daily operational quality huddles, where every morning they meet in a stand-up meeting for 5-10 minutes and discuss the Kaizens that they did yesterday and then what they want to try for today. We do that in a few of our units here, where it's a time every single day. A team in the area meets and goes to their Kaizen board, and they start working through Kaizens. Other managers bring it up in their meetings. At the end of every meeting, the last 10 minutes, they say, okay, what Kaizens do we have? Or what have you thought of? Or what have we implemented and how's it going? So it's a part of every manager meeting. Just like Mark said, putting it out there on a regular basis by whatever means, I think is important. And to follow along with Mark.
How do you, oh, sorry, go ahead, yeah.
How do we engage? We do training. We do open training sessions where we teach staff about the 8 wastes. We teach them about 5S. We'll teach them 5S, a lean practice, and then we'll show them lots of examples of applied in healthcare so they can connect it back to their place. Then we hand them Kaizen forms and say, go do. So that helps connect. Train them on deviations from normal, from interruptions, with lots of examples that they might see in their workplace, and then send them off to go try to implement those things. But in healthcare, it's got to be simple, easy, and relevant to the work they're actually doing.
Right. So we'll end in about 2 minutes. I'm going to ask maybe 1 or 2 more questions here. And then I will compile the questions that we didn't get to and send them to Mark and Joe to answer. And Mark has agreed to post those questions and answers on his blog. So you'll be getting a link to that, to his blog with these questions that we didn't get to. Do you engage physicians in the Kaizen events, and do you engage patients as well? And if so, how?
I would say yes. I mean, Kaizen events, that's a different story. That yes, I think it's definitely a best practice, and I've been involved in this. When you have a scheduled, planned, formal Kaizen event, to absolutely have physicians when it involves them, and to have a patient involved, and to actually have a real outside external patient. I've been in a children's hospital where they tried to have a staff member whose child had been sick and had been in the hospital play that role of patient and family, and that nurse knew too much about how things really worked. It wasn't a real true outside perspective. Um, but in terms of daily Kaizen, I mean, physicians will participate in a daily Kaizen process and identify things that are barriers to them. They'll come up with changes to what medications should be stored in a drawer. They'll come up with changes to clinical protocols. I mean, doctors will participate in this process just the same. Greg Jacobson, who's the CEO of Kinexus, he's an emergency room doctor. He started with Kaizen at Vanderbilt University Medical Center, working with physicians. And believe it or not, they struggled. And their question was, and we laugh about this. He said, "Well, we struggled with getting non-physicians involved and engaged in Kaizen." And non-physicians will say, "We struggle with getting physicians involved." I mean, I think if you talk to them, if you ask them to identify problems or barriers, you ask them to help fix things, you provide support when necessary. Doctors aren't that different. They'll participate.
Very good. Okay, I think that'll do it for today. Like I said, the remaining questions we'll shoot those over to Mark and Joe and give them a chance to answer those as well. Thanks again, everyone, for being with us today. Thank you very much, Mark and Joe, for your presentation. As a reminder, you can pick up your copy of Healthcare Kaizen. Follow the links there on the slide. And with that, we'll bid you a good day. And thanks again, and keep looking forward to more communication now from the Shingo Institute, who administers the Shingo Prize. Thanks again. Have a great day.